Welcome back, and in today's video we are going to take forward our discussion in knee complex biomechanics, that is into the patellofemoral joint. The wide variety of conditions related to patella, like patellofemoral pain syndrome, the anterior knee pain, the patellar instability, fractures, and a lot of conditions make patellofemoral joint and patellofemoral biomechanics a much discussed matter. And here we are going to have step-by-step simplified tutorials on the patellofemoral joint biomechanics. And in this video, we are going to have the basics, that is the anatomy of the patellofemoral joint, the patellofemoral joint itself, the articular congruence of the joint, and the peculiarities, and some conditions like patella alta, patella baja, etc. If you wish to know any particular conditions in particular, the time codes are given in the description and comment section. Please check on to that. Let us focus on to the patellofemoral. And we start our discussion with the basics, that is the anatomy of patella. You know that patella is something like it is a shape like this, that is it is an inverted triangle. Yes, the patella is an inverted triangle shaped bone, which is, of course, you know that it is a flat bone. Yes, it's an inverted triangle like flat bone, which is, you know that here you have the quadriceps tendon and it passes, and here you have the patellar tendon. Yes, embedded in the quadriceps tendon, Yes, that is the patella. It is a flat shaped bone, something like this, a flat shaped bone, something like our hand, a flat shaped bone which is in shape of an inverted triangle. That means this is its apex, and the apex is pointing downwards, and this is its base, which is the attachment site of the quadriceps muscle, which we saw in the previous video, right? Which serves as the attachment site of almost all the quadriceps muscle. And it is embedded in the quadriceps tendon. Since it is embedded in the quadriceps tendon, this is the largest sesamoid bone in the body. See, this is the largest sesamoid bone in the body. Yes, that's a brief anatomy of the patella. That is, patella is an inverted triangle shaped bone which is flat, of course. Its base is pointed downwards, and apex is pointed downwards, and base is at the top, which is the site of the quadriceps muscles insertion. It is embedded in the quadriceps tendon, and it is a sesamoid bone, right? Now we move on to the next aspects. That is, this joint or this patella has two surfaces which are to be discussed in detail, that is the anterior and posterior surface. And we see that in patella the articulation is formed purely by the posterior surface. So that means in patella the articulation is not by this anterior surface but by the posterior surface. The anterior surface is not having any articular role. Yes, the two surfaces which are to be discussed in the patella are the anterior and posterior, and we see that the posterior surface of the patella is sitting on the femoral condyles like this, There is no anterior surface contact. That is the posterior surface. And now we are going to discuss onto the biomechanics. So we need to dig upon the posterior surface. Yes, let us draw another diagram showing the posterior surface of the patella. Yes, Let us imagine this as the posterior surface of the patella. We see that there is a central ridge in the patella. There is a central ridge in the posterior surface of the patella. This is a vertical ridge. There is a vertical ridge in the center of the posterior surface of the patella, making it a medial and lateral articular facet, making this a medial and there's a lateral articular surfaces. See, this medial ridge or the central ridge divides the patellar articular surface into a medial facet, that is the medial facet, right? What is it? It's a medial articular facet, and here you have the lateral facet and the lateral facet. Yes, the medial and the lateral facet. And in some cases or in some individuals, this medial facet or the medial aspect of the patella again has one more vertical ridge which divides the medial facet into an extremely medial facet, and that is known as the odd facet of patella. That is known as the odd facet of patella. Yes, that is the medial facet is again divided by one another vertical ridge in few individuals, or of course in most of the individuals, and that makes that medial facet into an extremely medial facet, that is the odd facet of the patella, right? So that is the brief discussion into the anatomy of patella. That is, we saw the shape and size of the patella and we went on to the posterior articular surface, which is our point of interest because that is the articulating surface in the patella, right? Yes. And now we have the femur over here, right? We have the femur over here. This is its medial face condyle. This is its lateral condyle. And now, when the knee is in extended position, the patella sits over here. Okay? And when knee move from extension to the flexion, finally patella enters into intercondylar notch. If we evaluate the lower end of the femur or the distal end of the femur, we see there is a lateral condyle, medial condyle. But there is a groove in the center of that condyles that is known as the intercondylar groove. And this surface, the smooth surface or the surface on which the patella comes in contact is known as the patella surface or the patella femoral surface or the patella surface. That means now we are going into discuss about the femur, and we see few important things. That is, in the distal end of the femur, we have what we have. Two condyles are there. That is the medial and lateral condyle, which is quite known to all of us. And we see that there is an intercondylar groove. Intercondylar groove. Okay, this intercondylar groove corresponds to this vertical ridge in the patella. This intercondylar groove corresponds to the vertical ridge in the patella. Okay, you can tell it. Okay, now when we evaluate further, we see that there is an articular surface for the patella, and that is known as the femoral surface or patellar surface. This we had discussed in the beginning of the knee complex. That is femoral sulcus or patellar sulcus or patellar surface. That is an articular surface for the patella in the femur is known as the femoral sulcus or patellar sulcus. And when we see this is having a medial and lateral lip, a medial and lateral lip or facet, a medial and lateral facet, or a lip, medial and lateral facet or medial and lateral lip. And what does this medial and lateral facet do? This lateral facet articulates with the lateral facet of the patella, and this medial facet articulates with the medial facet of the patella. That means when we evaluate our discussion, when we continue our discussion on the femur, we see that there is an intercondylar groove, there is an intercondylar notch, there is the patellar sulcus or patellar surface, and it is having a medial lip over here or medial facet and a lateral facet. And a close examination, we can see that the lateral facet is slightly convex and its tip is slightly having a distal orientation. That means, once again, when we evaluate closely, we see that this is the lateral facet, this is the lateral facet, this is the medial facet, this is the intercondylar groove, this is the intercondylar notch. In this lateral and medial facet, we see that this lateral facet is bit more convex and it is slightly more distal than the medial facet. Yes, and it is having a lip which is more prominent than the medial facet. And why am I telling it? That is because this small structural modification in the patella on the femur itself is having a great role in the stability of the patella. To provide the lateral stability of the patella, this has a slight role or a great role along with other structures like lateral retinaculum and lateral patellofemoral ligament, etc., which we will discuss later. And these are the peculiarity of the patella and the femur. And now we see, as I told, the patella is sitting on this, floating on this bone, just with the connection of a tendon. And this articular surface of the patella is very small as compared to this area, which makes this joint one of the most incongruent joint in the body. So patellofemoral joint is one of the most incongruent joint in the body. When a joint is incongruent, there is a greater need of static and dynamic stabilization. There is a greater need of static and dynamic stabilization to keep the joint as such and to keep or provide the joint range of motion. The static stabilization is provided by various ligament system which we discussed, like lateral patellofemoral ligament, medial patellofemoral ligament, lateral retinaculum, extensor retinaculum, and various other structures which we will come again to discuss in the next sessions. Yes? Now, let me ask you, what is the role of patella in human body? Why do we have something like patella? Yes, we had discussed in hip flexors and hip extensor anatomy biomechanics that patellofemoral joint or patella serves a two function. One is it acts as an anatomical pulley. It acts as an anatomical pulley. Yes. How does it act as an anatomical pulley? It increases the momentum of the quadriceps muscle and increases the line of pull of the muscle. We had a detailed discussion on this in the biomechanics of knee extensors. If you have more doubts and if you want to know how it is increasing the momentum, just check onto that video. I have given the link above. That is, it acts as an anatomical pulley by increasing the momentum and increasing the line of pull of muscle and modifying the line of pull of the muscle. Secondly, it reduces friction between the quads tendon and femoral condyle. What is this? What is this actually? You imagine a situation in which there is no patella over here. What happens? The quadriceps tendon should come into a frictional contact between the femoral condyles. So that is a frictional contact. But now what happens? Here you have the hyaline cartilage covered posterior surface of the patella, which is very smooth, and the femoral condyles can come into contact with that, and the quadriceps tendon can go in contact with the anterior surface of the patella, which reduce the friction in that joint, right? So these are the two important functions served by the patellofemoral joint, that is an anatomical pulley, friction between quads tendon and femoral condyle, and thirdly enhances the kinetics and enhances the kinematics around knee joint. What do you mean by that? That means enhances the motion around the knee joint, enhances the motion or modifies and remodels the motions that are possible in the tibiofemoral joint or patellofemoral joint or knee complex as such. So these are some functions served by the patella. And finally, the patella is attached inferiorly through the patellar tendon into the tibial tuberosity. So patella is attached inferiorly to the tibial tuberosity. I told you patellofemoral joint is one of the most incongruent joint. Therefore, it requires a lot of muscle as well as active and passive stabilization forces. And we will see that stabilization force one by one in upcoming sessions. But now we have to see some more peculiarity of the joint surface and some more role of the patella in the tibiofemoral range of motions. Now let us proceed our discussion into the joint concurrence in patellofemoral joint. Joint concurrence in patellofemoral joint and the articular surface and articular surfaces. Very good. Alright. Now, there are two positions of the knee. One is an extended position, one is flexed position. In extended position, the patellofemoral joint or patella lies in this area. It has not entered the intercondylar notch, which is at the flexion, which will help in increasing the stability at the knee joint. For better understanding, let us look at like this. Now the patella sits over here at extension. When flexion, it drags on and reaches this condylar notch, which increases the stability of the patella. So stability at this particular position is not a matter of concern because it is in that notch and it is highly stable. But that's not the scenario at extension. At extension, it is simply sitting over here and it has to be stabilized. How? It is stabilized medially and laterally by the medial patellar retinaculum, medial patellofemoral ligament, lateral patellofemoral ligament, and of course oblique ligament and various muscular connections. Right? That provides such stability. And the relative position of this patella in respect to the femur or in respect to the femoral condyles is determined by the length of the patellar tendon. Means you know that the patella is attached from here to this tibial tuberosity via the patellar tendon. If the length of the patellar tendon is higher, that means if the length of the patellar tendon, for example, it is 2 cm, but here if it is 2.5 or 3 cm, what happens? The patella will sit in a bit more higher position. The patella will sit in a bit more higher position, and that is known as patella alta. When the position of the patella is bit more higher than the normal, it is known as patella alta. And there is a condition when this patellofemoral or patellar ligament or patellar tendon is shorter than usual. That means it is 2 cm, it becomes 1.5 or 1.7 cm. So this length decreases and naturally the patella comes down. That position is known as Patella Baja. And you know that anything away from or anything other than the normal dynamics, normal biomechanics is a problem. So Patella Baja and Patella Alta are two conditions which can inhibit or cause instability in the knee joint. And this length between patellar tendon and the diagonal length of the patella is used to determine or find out the position of the patella. That is, ordinary, the ratio between the patellar tendon length, and the diagonal length of the patella is 1:1. When this length decreases or increases, when it becomes 1:2 or 2:1, this shows that the patellar position has changed relatively. That means the length of the patellar tendon has either increased or decreased, because you know that the diagonal length of the patella remains the same. That is, this length of the patella, okay, this diagonal length of the patella remains the same. Only thing that can change over here, mostly except in few cases, is the length of this patellar tendon. If the patellar tendon is relatively short like this, okay, what happens? The patella comes down, right? The patella comes down. Condition known as Patella Baja. Whereas if the patellar tendon is relatively a longer one, what happens? The patella goes up, and that condition is known as Patella Alta, right? So this ratio is known as INSALL Salvati Index. What is INSALL Salvati Index? INSALL Salvati Index is a ratio of patellar tendon to the diagonal length of the patella, which is used to determine the position of the patella with respect to the femoral condyles or femoral sulcus, right? Yes. And about patellar, this condition in which the length of the patellar tendon is larger, and that is known as I told you, Patella Alta, Patella Alta, or high riding patella, and this condition is known as Patella Baja, or low riding patella, So in this position, patella will be in a low length, and in this position, patella will be bit higher than the normal. And when it is bit higher than the normal, you see that, for example, if this is the position of the patella, when flexion increases and increases and increases, when flexion goes on, this can go into the femoral sulcus more easily and intercondylar knots easily. But what happens here in Patella Alta, already patella is in a higher position, so more amount of flexion is needed until the patella reaches the intercondylar knots. That means in cases of Patella Alta, the patient will have a greater role of instability or a greater instability in greater range of motion, because only lately the patella is going to enter into the patellar sulcus or the intercondylar knots. Just remember that. And now we are going to see the last discussion in this session, that is the relationship of patella with regard to knee flexion and extension. To understand the role of patella in knee flexion and extension, we should remember that the patella is not relatively standing in a fixed position. It is actually floating, as I told you. From extension to flexion, the patella is being dragged on. So, to understand what are the changes or how far the changes are going in patella, let us examine with the help of few diagrams. Yes, 1, 2, 3, and 4. Okay. Of the knee extension, at the beginning of the knee extension or in the initial degree of knee extension, only the inferior margin of this patella or the inferior pole of the patella is in contact with the femur. Now when flexion increases slightly, what happens for example in a 20 degree of flexion, the inferior margin of the both medial and lateral facets, at about 20 degree of flexion, inferior margin of both medial and lateral facets come in contact with the femur, right? When flexion increases again, for example at some 60 degree, almost all part of the patella comes in contact with the femur except the superior region. Whereas at about 90 degree of knee flexion, completely the patella comes in contact with the femur. Completely patella comes in contact with the femur. Whereas if flexion increases again from 90 to 130 degree, that is the maximum flexion, what happens? Again, only a very small portion of the patella, which is the medial facet, the odd facet and the lateral facet, comes in contact with the femur. So see, the position with respect, or the contact with respect to the femur, is changing when patella is in the femoral sulcus. At beginning of the extension, only a small pole, that is the inferior pole of the patella, has a contact with the femur. Now when flexion increased to 20 degree, inferior margins of medial and lateral facet, of course we have the medial facet and lateral facet like this, comes in contact. Whereas at 60 degree, almost all part except the superior region, base of the patella, comes in contact. And at about 90 degree, almost all part except that small odd facet over here, everything else comes in contact. And when flexion increases again to 130 degree, the contact area again decreases to the lateral facet and the odd facet. So this is how the relative position of the patella changes with respect to the femoral sulcus or femur. If you draw a diagram of a femur like this, okay, what happens? At initially only the inferior pole of the patella is in contact. At 20 degree of flexion, okay, at 20 degree of, let us draw it once more. That is, initially only the inferior pole of the patella is in contact. And when flexion increases to about 20 degree, the inferior margin of medial and lateral sockets comes in contact. And when flexion increases a bit more, 60 degree, you see only the superior area is paired, all other areas are in contact. When flexion increases again to 90 degree, almost all parts are in contact. When flexion decreases or increases again, the contact area further decreases. And finally at the 135 degree, you have only a slight contact in the medial socket and lateral facet and the medial facet or the odd facet. So this is how the changes with respect to the position of patella happens. And why are we discussing it? Because this is very important when we discuss about the patellofemoral range of motion, patellofemoral motion or patellar motion, and the stability of patella. So with this we wind up this session, and next section we are going to have a very detailed discussion about the motion of the patella in particular. Right? Until then, stay tuned, and if you like the video, don't forget to click the like button and subscribe to our channel.